It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. How long does it take for a dog to expel a foreign object? Before going into more detail about the mechanics of how long it takes for a dog to expel a foreign object, the first question to answer in more depth is whether it is possible for it to be expelled. The answer is, it depends. Some foreign objects are larger than others and some dogs are small. It is possible for a dog to expel a foreign object in as little as 10 to 24 hours. This is only if it is small enough to pass through the digestive tract and does not get stuck. While it can be swallowed easily, getting it through your dog is another story. In many cases, very small, smooth foreign objects can easily pass through a dog's digestive system. But there will be other strange objects that have design features that can complicate the situation. So, in theory, your dog can expel a foreign object, but whether he does so will depend on a number of factors including: is the foreign object small enough to pass through your dog's system? Is your dog big enough for the foreign object to pass through? Will the foreign object pass through your dog without the mouthpiece catching it? Does the foreign object have sharp sides or strange angles and points? You may not know if the position is good unless your dog has an X-ray or ultrasound at the vet to check that the foreign object is not stuck. The conclusion is the following. Some small foreign objects will be small enough to pass through your dog without intervention. Other larger foreign objects, such as socks, may become stuck and require surgical procedures to remove, or vomiting if they are still in the stomach. How can you get your dog to pass a foreign object? Call the vet immediately. As soon as you see that your dog has swallowed a foreign object, you must act. You have about 2 hours before the toy or foreign object reaches their intestines, so this time is critical. While you should stay calm, that doesn't mean you should just sit back and wait if the foreign object passes through your dog's poop. Can you see the strange object? If you can see the foreign object in your dog's mouth and he hasn't completely swallowed it yet, try to carefully remove it. If it's close to your throat, don't try to pull it out, as you could push it further down. Is your dog choking on the foreign object? If choking begins and you cannot remove the foreign object from your dog's mouth, you can try a Heimlich maneuver. There is a video on YouTube that shows how to do it. Don't induce vomiting unless your vet tells you to. While it may be tempting and makes sense to make your dog vomit, don't do it. This is key, because if it's a sharp object, it could cause more damage on the way back, so describe the foreign object to your vet and wait for guidance. If he decides to induce vomiting, your vet might recommend that you give the dog 2 teaspoons of hydrogen peroxide to make him sick. What does the vet do? Depending on the diagnosis, your veterinarian may induce vomiting in the clinic. He may first do an X-ray or ultrasound to see where the foreign object is before making a decision. When vomiting is not an option and the veterinarian does not believe the foreign object will pass into your dog's stool, surgery is performed if the object reaches the intestines. Remember, your dog has a digestive tract that starts in the mouth, goes down the esophagus, passes through the belly and small intestine, reaches the colon, and finally the rectum. This is the point at which a foreign object could be ejected if it gets that far. While most foreign objects will pass through a dog after 24 hours, some objects can stay stuck inside your dog for longer. How do you know if your dog will expel the foreign object? Just as the foreign object can pass through your dog, there is also a possibility that he will not pass stool. There are some clear warning signs that the foreign object will not pass, such as: your dog is vomiting. Your dog is touching his mouth. Your dog is choking. Your dog is drooling more than usual. Your dog has loss of appetite. Your dog is acting strangely, including lethargy. Your dog has diarrhea. Your dog is constipated due to an obstruction. Your dog is showing obvious signs of pain. Conclusion: if your dog has swallowed a foreign object, call a veterinarian. Your dog will most likely be fine, but you should never take risks. There is no guarantee that he will expel him. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.